Patients who have sinus problems usually present with congestion and nasal obstruction. They can't breathe through their nose. Sometimes patients say to me that they wake up in the morning, their teeth hurt, maybe their cheeks hurt, and they don't know whether it's a cold or allergies or another sinus infection. And so patients that present with these type of symptoms often have trouble. And if you're having recurrent symptoms like these, and they're 5 to 6 times a year, then it's likely that you're having recurrent sinus infections, or maybe you have chronic sinus abnormalities. So there's an obstruction in the sinuses, you don't have proper drainage, and so it's best to have an evaluation. The proper examination is, one, to be seen by your primary care doctor and be referred to an ear, nose, and throat specialist. We'll evaluate the patient, and during this evaluation, we'll take a look at the sinuses using a small little scope in the nose, and we'll look for evidence of inflammation, evidence of obstruction, also for evidence of infection. And so we put all this together with a CAT scan of the sinuses, and then we take a look at the anatomy and see if the anatomy is abnormal, see where the obstructions lie, and then recommend medical therapy or surgical therapy. What are the sinuses? They're just air-filled sacs within your skull. The sacs are the frontal sinuses, the ethmoid sinuses, the sphenoid sinuses, and then the maxillary sinuses. And so in order to keep the natural openings of these sinuses patent or open, we prescribe different medications such as anti-allergy medicines, as well as topical steroid medicines. So these topical steroid medicines help to decongest the nose. In addition, the anti-allergy medicines help to decrease your inflammatory response to the allergens that are around you. But sometimes the medicines don't do what they're supposed to do because the problem is too severe, and that's where we come in and recommend sinus surgery after a thorough evaluation in order to open up the natural ostia of these sinuses.